Welcome back. More than 70 million people suffer from chronic pain in this country, and the stress of the holiday season can bring lots of painful symptoms. This morning, Dr. Tomer Anbar, Medical Director of the Chronic Pain Rehabilitation Program at Scripps, is here with some advice for those people suffering from chronic pain. Good morning, and thanks for joining me.
Thank you for having me.
70 million people, that is so many, and it can really destroy lives, can't it?
Absolutely. Most people with chronic pain suffer from a chronic pain syndrome. So it affects their ability to sleep, it affects their memory, it causes them to have problems functioning. Depression and anxiety are part of a chronic pain syndrome. Typically you'll gain a lot of weight or lose weight, and it has a huge impact on your immune function. So what happens is you're more vulnerable to viruses, bacteria, cancer cells. Another thing it does is stress and chronic pain being very much related, since chronic pain causes a great deal of stress, causes your muscles to become very tense. It causes less blood to go into your organs, so you're getting less blood nutrients, you're less able to take the toxins out of your body. So what's very important is to reverse all of this if we're going to reverse a chronic pain syndrome.
How come so many people can't get a hold of their pain? I mean, there is chronic pain and there is chronic pain syndrome. What is the difference, and how do you approach treating each one?
It's an excellent question. Most people who suffer from a chronic pain syndrome means that their chronic pain doesn't go away, by definition. So they begin developing these other symptoms. Now, the difference between pain management and pain rehabilitation is pain management uses medications to try to lessen the feelings of pain. Pain rehabilitation goes to the root of the symptoms, whether it be the chronic pain, the depression, the anxiety, and so on, and it helps you heal the process. So actually pain management should be a part of a complete pain rehabilitation program.
Are most patients in this country suffering from pain getting the adequate treatment? I know there's so much publicity about the bad effects of pain medication and the how easy it is to become addicted to some of these drugs like OxyContin and Vicodin. But are most patients being treated appropriately?
Actually, only 3% of medical schools have an elective topic on the treatment of chronic pain. So the tragedy is most people will never get appropriate treatment for their chronic pain. But the good news is that if you get into a chronic pain program, you can systematically reverse the chronic pain and the disability. So one of the things we're doing, and the focus at Scripps Mercy Hospital, is to make chronic pain rehabilitation programs available to the largest number of people.
And what about insurance? Does insurance pay for chronic pain treatment management?
Well, the exciting thing is that as of July of this year, in the state of California, as well as other states, the state has mandated, really, that the best treatment for chronic pain with respect to a work-related injury is a comprehensive rehabilitation program. So now really for the first time, people have access to the most effective type of care. But it's important to ask your physician to refer you to such a program. It's important to speak to your insurance carrier, and particularly your employer, and let them know that these new guidelines are designed to help you overcome your chronic pain syndrome. It decreases the cost of the claims to the insurance carriers and naturally helps the employer, all by helping the individual overcome their chronic pain syndrome.
Well, it's nice to know that there are chronic pain places to go for people that are in pain, and one of them is the clinic at Scripps Mercy. Dr. Anbar, thanks so much for coming on the show.
It's been a pleasure. Thank you very much.
You as well. Happy holidays.